Hello and welcome, everyone. Welcome to today's Hunger, Nutrition, and Health and Pregnancy Quarterly Connect meeting. I'm Rachel Forensic with the CDC Foundation, and I'll be one of your facilitators today. Great to have you all here today. I see folks are starting to slowly jump into the meeting. So let's have folks, while folks are as we're getting started, put in your name and your organization into the chat so we can see who is with us today. Just give folks another 30 seconds to get going. So if you're joining, please go ahead and put your name and your organization into the chat. Awesome. All right. Again, welcome. Glad to have you here today. The mission of the Hunger, Nutrition, and Health and Pregnancy Action Network is to improve nutrition and health outcomes from preconception through early childhood by bringing together organizations that can leverage their collective strengths and resources. And so that's why your presence here matters. We need to know what you're up to and also be a place where you can help connect to others who are doing complementary or similar work to what you're doing. So today's agenda is a little different than our typical quarterly meeting. We are not going to have breakout sessions. We have two different presenters that are here today. So we're going to focus on a conversation with them. We're first going to give you a few important network updates, what we've been doing since we last saw you. We're going to have a quick Mentimeter activity to get your input on some strategic direction of the network. And then we are going to have a conversation with Shannon Vance from ASTHO and Amilcar Guzman from Pritzker Children's Initiative. So let's go ahead and get started. I'm going to start with some updates on the network. So in March, just a few months ago, we presented at the AmChip conference, and our session was titled Grounded in Science, Powered in Partnership, Lessons from the Hunger, Nutrition, and Health and Pregnancy Action Network. We had a great turnout. It was wonderful to have the opportunity to be able to share about our work and our lessons learned so far. Hopefully bring in some new members to the Action Network and really be able to broaden our reach to a larger maternal child health audience. While we were in DC at the AmChip conference, we also hosted an in-person reception on one of the evenings, and it was a great chance for members to connect face-to-face and build relationships beyond our virtual meetings. We had twice as many people attend as we did in 2025, and I would say probably at least 10 times the energy that we had in 2025. It was really fun to have folks together networking. The day after, our steering committee held an in-person priority setting session, which is an important step as we look ahead and we sharpen our strategic focus as a network. We've also submitted an abstract to the City Match conference that will be taking place in Portland, Oregon in September. 3 of our organizations submitted something as a panel. And so if accepted, we will be presenting at City Match for any of you that will also be at that conference. And we also would try to plan another in-person gathering for any of our members that might be at that workshop or even in the Portland area. And we're also about to begin work on a strategic framework and strategic planning process for the Action Network. And so your feedback today via the Mentimeter activity is going to be a really important part of shaping that direction. We're also in the process of updating our website. We'll have more resources. Things will be a little bit easier to find on the website. So more to come on that. And additionally, we're also building a virtual Rolodex for our members, which will be a way to showcase who we are and make it easier for members to find and connect with each other. So, in the next probably week or so, you'll get an email that will have a form you can use and an example of what it will look like once you can fill in just a few details about yourself so that we can stay connected and know who to reach out to whenever there is, some kind of issue that you might have or someone that you want to connect with. All right. So with that, I think I am now transitioning the conversation over to my colleague Nikki Ulrich from OHSU for the Mentimeter. Nikki?
Yeah, great. Well, I'm so happy to be here with you all. My name is Nikki Ulrich, as Rachel just mentioned. I'm the Community Engagement Manager at OHSU's Moore Institute for Nutrition and Wellness. And I've had the pleasure of working in this network and got to attend the AMCHIC conference and be part of some of the in-person priority setting meetings we held in March. And part of that, part of the results of that meeting was identifying the importance and the need to set some strategic priorities and strategic direction for this action network moving forward. So a small group of us got together a number of weeks ago now to discuss what that might look like, what that journey may look like, what that roadmap, what form it might come in, what are like organizations or things and elements within strategic planning documents or roadmaps do we value and want to see happen. And part of that discussion also included hearing from the wider network, hearing from folks like yourselves about what matters to you, what values you hold, and why you show up in spaces like this. So for the next few minutes, we're going to go through a Mentimeter where I'm hoping you will share some of those insights with us and help set some of the strategic directions we take over the next period of time. So I'm going to go ahead and share my screen. Perfect. So we'll work through this Mentimeter and hopefully you'll be able to see these results. If you're not familiar with Mentimeter, there's some information in the chat on how to log in. If you're on a desktop, you can use the URL code at the top and then the number code at the bottom. If you have a cell phone close by, sometimes that's a great way to also engage with this part of the presentation using this QR code. So I'll give it another 5 to 7 seconds for folks to get logged on, and then we will get going in this Mentimeter. Great. All right. So one of our first questions for you today was, what do you think a network like this one should primarily do? Feel free to select your top 2 choices. They may be things like building and advance the science, connect with people across the organization, align members around shared priorities, amplify the work of member organizations, create a space for peer learning, or influence policy and systems. So we'll give a few more seconds here for folks to continue to put their responses in. There's something very fun about watching these trickle in. All right. Get your final answers in there and we'll move on to the next question. All right, I'll go ahead and move on. Continue to answer as you are able to. How do you see your role in this network? We're asking you to select one. Your role may look like primarily a learner, come to receiving information. Maybe you come as a connector, helping to build bridges across this network. Maybe you're here because you're a contributor, you bring in expertise. If you're still here deciding how I'm showing up, where I might best fit in, maybe you're not quite sure yet, or maybe you really see yourself as a mix of some of these things. Awesome. All right. It's like the answers are starting to dwindle down. Thank you so much for sharing. We'll move right along. Our next questions would what would make you feel more like an active member of this network? And you can select as many as you like here. Some of our answers that we provided was nothing. You already feel like an active member. Some things maybe being more involved in setting the priorities or direction, maybe having a clear role or contribution to this group, maybe having more consistent communication between meetings, maybe something like feeling like my expertise is recognized and used, or maybe knowing other members better and having a relationship with them. So again, feel free to select as many answers that resonate with you here. All right, I'm starting to see those answers start to slow down. Thank you all so much for sharing this feedback. It's really interesting to see these answers come through. I think there's just a couple more maybe here. Our next question for you was, when you engage with this network, what do you find most valuable? And we're actually asking you to rank these choices. So the things that we provided would be getting a state of the science updates, so better understanding the science that we are founded upon, maybe getting updates from partner organizations within the field, discussion or peer exchange, collaborative problem solving, or hearing about policy or systems level developments. So again, for this question, we're asking you to rank what feels most valuable to you. Thank you all so much for contributing to this. It's interesting to see all of these get re-ranked as you submit your answers. I'm going to keep moving us along, but please answer those as you log in and move through that Mentimeter at your own pace. Last but very much not least, and take the time you need to answer this. Is there anything you wish this network did more or less of? And so as you formulate these questions, they'll populate on this screen, but know that you always have our ear and our open inboxes if you have other suggestions for us during this meeting or after this meeting to continue to increase the value and the strength of this network.
Nikki, this is Diane. I don't
Yes.
think this question
Yeah.
is working. Um,
Oh, perfect. I'm getting some responses, but you're right. I'm not seeing things come through.
We'll have an end of meeting survey that comes up where people could
Yeah.
also stick any more or less of responses if they'd like.
That sounds great. Well, I appreciate everyone else's responses for the other questions. Hopefully, some of those other open-ended questions come through in the final report, and we'll send a follow-up after today's meeting. I think from there, I can pass it over to Leanna.
Hello, everyone. So I'm going to lead us in a discussion with a couple of folks in our meeting today. Now, during our last meeting in March, we learned about food as medicine programs in the Atlanta area with the collaboration from Open Hand Atlanta. We heard from Laura Semnata there, and Care Source. We heard from Lisa Pennington. So today we're going to chat with Shannon Vance from the Association of State and Territorial Health Officials, better known as ASTHO, and Amilcar Guzman from the Pritzker Children's Initiative. They're going to talk to us a little bit about their organization, the work they do, specifically around the prenatal to age 3 timeframe. And we are going to start with Shannon because Amilcar is joining us in just a few minutes from another meeting. So we will start with asking Shannon a few questions. I believe Amilcar has a few slides he's going to share with us about a new policy initiative that his organization just put out. I have some questions for both of them, and then we will open it up to the audience for all of you to ask your questions as well. So first we have Shannon Vance, who is the Director of Maternal and Child Health at the Association of State and Territorial Health Officials, ASTHO. And I think she is going to start off by telling us a little bit about what is ASTHO.
Yeah, thank you, everyone. I'm excited to be here today. Like was mentioned, I work at ASTHO and I am one of our directors on our maternal and child health team. I lead our child, adolescent, and school health portfolio, which I realize does not include the pregnancy time period, but I have a rich background in the early life nutrition space. It's something I find myself incredibly passionate about. So excited to be here to talk to you a little bit more about what ASTHO does, who we are, those sorts of things. So for those who are unfamiliar, ASTHO is a nonpartisan member organization of all of the chief health officials across the nation, including the territories and freely associated states. We provide technical assistance and policy support to both the health officials and then their agency staff. For me and my team, what that looks like is we have several grant-funded projects where we provide hands-on technical assistance around a number of topics. ASTHO is structured sort of similar to a state health department in that we have teams that work on many different departments, thinking maternal and child health, environmental health, health security, preparedness, all sorts of things. So we do a little bit of everything, including doing policy support and helping equip members when they go up to the Hill and those sorts of things. So kind of all over the place with what we do, but doing our best to support state health officials and their staff.
And your organization is based in where?
We're based in Washington, D.C., but obviously because our members are everywhere, we are also everywhere. I personally am based in Portland, Oregon, which is quite funny that there is a number of OHSU people here. But yeah, we are primarily based out of D.C., given the proximity to the Hill and legislative branch.
And can you tell us a little bit about why we're going to talk about PN3 today as the acronym we're using, so prenatal to age 3. Can you tell us a little bit about why nutrition during this time frame is a priority for your organization?
Yeah, of course. And it feels a little silly, my answer, because it is pretty obvious, I think. But we all on this call hopefully can agree that the earlier you intervene and the earlier you improve a certain portion of someone's life, the better that person will be when they age. Prenatal-to-3 is the perfect time to intervene when we think about healthy, nutritious foods. And health officials know this, their teams know this, and they know that if if they focus in this early life time period, then the programs moving forward throughout their lives will be more effective. Hopefully, in a perfect public health world, we'll work ourselves out of a job, but it's a priority for us because our health officials recognize that it's an issue, will probably continue to be an issue. And so what we do is support as much as we can, both through technical assistance and also through the policy support, and see if there are any additional levers, both at the state and then federal level.
You had this isn't brand new, but not too long ago, you had an early childhood nutrition security looking at state level approaches. Can you tell us a little bit about I just totally bungled that. Can you tell us a little bit about the
Okay.
report that you guys had just in the past
Of
couple weeks?
course. Yeah. So, like you mentioned, it's not brand new. And as I'm sure we all know, the public health landscape has changed in the last year and a half or so. So, take all of that with a grain of salt, but still a really important report. As a previously funded HRSA Maternal and Child Health Bureau project, we did a 0 to 3 nutrition security pilot with 3 different state health departments. We looked at themes around how states were addressing infant and young child nutrition security, specifically this 0 to 3 age group. So we interviewed 3 states to discuss barriers and facilitators around their nutrition security programs or nutrition security program adjacent, to figure out what worked well, what wasn't working, any innovative programs. And you can see more detail in the report, but the 3 states we talked to were New York, Connecticut, and Illinois. And I'm sure when you have a moment to read the report, you'll see this, but the people we spoke with kind of ranged their role. Some folks were members of the SPAN program, which is a CDC nutrition program. Our folks in New York worked on the SPAN program. We have some staff that we talked to who are WIC staff. And then we have some others who kind of sat everywhere else within the health department. Because we sit on the maternal and child health team, oftentimes those are the people that we talk to the most. And so we speak with our MCH colleagues at the state, and you'll be able to see something that I'm sure will come as no surprise to all of you. The most important takeaway from these interviews that we did was the importance of partnerships, the importance of cross-sector partnerships. Having resources in other agencies is incredibly important, just kind of at a baseline, but especially when we think about things like nutrition security. 0 to 3, they touch so many different parts of the health and healthcare system. And all of those parts, unfortunately, don't often talk to each other, but when they talk to each other, things work out so beautifully. So, for example, in the state of New York, as part of some of their CDC SPAN funding, they created this program called the Creating Healthy Schools and Communities program, where they work with 25 local partners who work in high need communities to implement evidence-based strategies to improve access to healthy foods and opportunities to be physically active. It looks holistically at the family, but then specifically they're providing training and technical assistance around nutrition best practices for infants and young children under 5 who attend ECE programs across the state. They also, through these local partners, work to implement strategies around infant human milk feeding to help improve breastfeeding rates as well. All which is vitally important, again, to this 0 to 3 nutrition security piece. Yes, Diane, thank you so much it's so easy to speak in acronyms. One of the most successful facilitators, like I mentioned, was partnerships, and that's illustrated throughout the report. But the barriers were really interesting when we think about different programs. New York referenced a lot around a lack of diversity in their workforce, which makes it really hard to address disparities across the state because they don't have the correct workforce in order to meet the needs of the state. Agency procurement is an issue across the board when thinking about funding, when thinking about working with community-based organizations, all of these barriers that are so important to ensuring nutrition security at the most local level. States struggle. It if you sit at a state, it is not just you, it's everybody, which one would hope that that would mean that we could solve the problem a little bit easier because it's everybody's problem. But we remain we remain with that as a major struggle. So the report is quite short. It's 10 pages. Again, it highlights these three states and the work that they've done. Some of the programs are incredibly cool and could be replicated in many other states. Connecticut's got a really wonderful partnership between Head Start and their WIC program. And as we know, WIC is such a wonderful resource for this 0 to 3 age group, for this PN3 age group. And they have a robust partnership between Head Start and WIC called the Better Together Collaboration Project. It's a formal program themselves, and the program aims to increase enrollment and retention in both programs while also providing resources to improve nutrition security and improve school readiness. And so this interagency partnership is one of the best ways that we can illustrate nutrition security at work and how we can find ways to improve the livelihoods, improve access to food and nutritious foods for the PN3 age group. But I hope you enjoyed it. It's really interesting. Again, I did mention, and it was mentioned that it's not super new. It came out in 2024. But I will say, I think as you all read it, you can see many of the barriers probably still exist. Those didn't change with time. In fact, most of the barriers probably are a little bit more obvious in today's world.
The report is in the chat, so you can find it there. It's also pretty easy to find, I think, on your website as well. So you talked a little bit about the importance of partnerships within states. Can you talk to us a little bit about how states could go about partnering to move this work forward internally and then with other states as well?
Yeah, internally, again, this feels almost silly to say, but it is about reaching out and making genuine partnerships. Something that I see in my work every day is I work with people who so deeply care about whatever the topic is, whether it's nutrition security or something else, and they feel like their counterpart at the Department of Education or at the Department of Human Services um, might not be willing to hear them out, which for the most part is untrue. It's just that people are busy, and it's very easy to kind of kick the can down the road in creating new partnerships. So my best piece of advice is to reach out. If you want to work with someone else, you have to build a relationship and build trust, and that takes time. And if you sit at a health department and you don't quite know where to start, you're more than welcome to reach out to me, and we can help figure that out. It can be really scary, especially in a world where people are getting laid off. You don't know who's left, who's still there that could help out, but it's always worth it to just try. Internally, your funding will go much farther. The impacts that your populations see will be much greater if you can work collaboratively. And then across states, I think this is the reason why organizations like ASTHO and others exist, is because when you know one state, you know one state. Every single state is different. And the cross-state learning is where kind of like the best of the best happens, is that you can hear from someone in Tennessee and hear what they're doing with their nutrition security project or hear what they're doing with their breastfeeding work and think, okay, well, my population might be a little bit different, but how can I make that relevant to me? And it's that sort of gets your own wheels turning, gets you a little bit unstuck from perhaps some of the things that haven't worked in the past. It is hard. If it's hard to make internal relationships, it's even harder to make cross-state relationships. Again, because that can even fall farther down the list of priorities. So again, more than happy to be a resource to anybody here, to help with those cross-jurisdiction relationships. The second best thing you could do is go to a conference. I know people love, hate, have lots of strong feelings about conferences, but putting yourself out there and networking will come back, and you'll be better for it. So I truly, it feels almost silly to say that the best piece of advice is to just like reach out and have conversations because that is hard. But if you reach out with genuine intention, I think that you'll get it back tenfold, whether it's internal to your agency, to your jurisdiction, or across jurisdictions.
No, I think that's fabulous advice. So besides reaching out to help define or bridge those relationships, why else should people on this call reach out to you?
I think truly again the partnerships piece, health departments are, and if there's anybody on this call who works at a state health department, hopefully you agree, state health departments are a wonderful convener. And so if someone is not a state health department employee but wants to work with them, we see this a lot with community-based organizations who are doing incredible work who don't know how to scale because they don't have the reach that a state agency would have. ASTHO can also be a resource for those people as well. We are not just a resource for state health department employees. We can be a resource for anybody who has questions or wants to do something with the state health department. Always happy to have any genuine conversation with someone because it's helpful for me too. If you have a great innovative solution, we can help not only share that across jurisdiction, but share that up. ASTHO is primarily, though not exclusively, CDC funded, and we have a really strong relationship with the federal government, and so we do share up quite frequently with what we're hearing on the ground of the successes, the real life challenges that people are hearing, and so if someone wants to reach out to me to talk about anything that they are experiencing related to public health in their city, town, state, my door is open. I sit in Portland, Oregon. I know my own personal experience, but I don't know anybody else's experience. And so if I can help elevate resources or challenges, I'm always happy to help do that.
Thank you, Shannon. Amilcar, have you joined us yet? You have.
Yes, I'm
Okay.
here.
All right. I'm gonna turn it over to Amilcar for just a second. I will introduce him and then we will have questions for both Shannon and Amilcar at the end. So Amilcar Guzman is the program officer for the Pritzker Children's Initiative at the JB and MK Pritzker Family Foundation in Chicago. So I'm going to hand it over to you to share some slides about a recent policy initiative that you have to put together.
Thank you so much for having me, Liana and Rachel and the whole team. Really looking forward to this conversation. I just put together a couple of slides to help guide the discussion. Can everyone see the deck? Yep. Oh, no. Let's see. Oh, that is why. What about now? Yep, great. Yeah, so I'm here to talk a little bit about a new initiative that was just launched last month in DC at the Food Research and Action Center, the FRAC conference, and it's Nourish from the Start. And really, what this effort is about is how do we make sure that more families, prenatal to three, so families with young infants and toddlers, have the right amount of food and the right food, right? So making sure that they have the nutritious food to make sure that they are successful. We know that there's so much research that talks about the importance of ensuring that throughout the prenatal to three period that families have what they need in order to be successful. And we've been engaged in this effort for close to 2 years now. When we started to think about what are the key supports that families need, we as a foundation have done work in other areas focused on childcare, focused on housing, right, focused on paid family leave. Right, but an area that we hadn't talked about was food, right, and making sure that families had what they need in order to be successful. So we started this journey uh, in September of 2024, right? So it has just become more and more important as the landscape has changed to make sure that we're working to help move some of this work forward. Just quick framing. Um, you know, The most recent data talks about nearly 2 million households, prenatal to three across the country, being food insecure, right? So this is 2023. Data has come out since then that shows more than 2 million, and you would anticipate that that number will just continue to creep up. Here we see some ebbs and flows across time, but what lots of the analysts have predicted that is this number will just continue to rise for a variety of different reasons. That, as we have all seen in recent months within the past year, we've seen things happening federally, right, in terms of how supports are under attack, right, and how priorities are shifting federally, right, as we think about things like SNAP, things like WIC. When you start to remove some of those supports, we would imagine, right, that it's just going to be harder for families with young kids to be able to provide adequate, nutritious food. We also know that at the state level, we're seeing a lot of changes too, right? So it's not just things happening federally, but with HR1, but also we've seen a number of states taking steps to restrict, right, the way that to restrict how different programs are being used, what families can pay for, and how families are enrolled, right? And making it, perhaps tougher, right, for families to be able to access some of these supports consistently. So about a year ago, we started to talk with some national partners, right, who work in this space and who have a long-standing track record of working on food security efforts federally, right? So they are often in many discussions as it relates to how do we ensure more families are food secure, but they also work in key states, right, to make sure that as things are implemented on the ground, that things are happening in a positive, productive way. And so we convened an advisory of these folks who met monthly, right, to really think about, okay, what is necessary? How do we develop a roadmap to ensure that more families are prenatal to three families are food secure, not only now, but in the future? So it was lots of discussion, lots of conversations, and thinking about what needs to happen, right? The product of that is our Nourish from the Start agenda, right, which kind of lists out some of these recommendations and really talks about if we can do these things federally, if we can do some of these things at the state level, then we know that that number that I shared, that 1.8, that is more likely now 2, will be able to be reduced across time. Now, this is not going to happen tomorrow, right? This will take time, right? So some of the recommendations that are in there, right, are both short-term and long-term. And when the partners came together, they talked about short term being really within the next 3 years under the current kind of national federal landscape, and longer term being 5 to 10 years, right? So what happens as we try to rebuild the country at that particular time? There's recommendations within the agenda that are state and federal, right? Some are both, right? But we and really the partners thought that it was important to really provide a comprehensive picture, right? It's not only programs that are funded federally, but it's how those programs are implemented on the ground across time. And the agenda really includes key insights into programs such as SNAP, WIC, and CACFP. There's more recommendations across some other federal programs, but those are the main 3 that the core partners really focus on. And the recommendations really are grouped into a couple of buckets, right? And I'll talk about them quickly. There's more than 60 recommendations, so and I have a kind of a picture of just one piece, but I'll kind of talk about some broader themes here, right? The first is in ensuring access to food assistance programs for prenatal to 3 families, right? So this is in many instances the immediate need, right? How do we fund, right, programs at the federal level? We know about cuts to SNAP, right? Potential cuts to WIC, right? How do we in not only bring those levels back to pre-HR1, but increase some of that funding for those key for those key programs that we know work federally. There's also some recommendations as to how states can do that as well, right? I kind of talked about the states are moving in the wrong direction in terms of restrictions for how these different programs can be used and how folks are enrolling. So how can states increase access, right? In innovative ways in terms of the length of certification periods, in terms of how families can be able to recertify, making it easier versus tougher, right? For families to be able to be recipients of these key supports. The second theme is about how do we modernize, right? So a lot of recommendations here about technology, right? About AI, right? As we look towards the future, right? This is more in the longer term bucket, but how can we leverage some of those technologies that exist in order to make it easier, right? In order to improve some processes for states, right? In order to be able to make it easier for all the parties involved to be able to deploy, access, and really implement the some of these supports that exist. This third theme is focused on the concept of making sure that it's not only adequate food, but it's the right food, right? So how can states, can the federal government leverage existing avenues, things like SNAP incentive programs, right? Things that are out there that will help families have access to healthier food. And it's not only healthy, but it's culturally significant, right? So also some recommendations in there as it relates to particular populations and making sure that those foods that are culturally significant are also covered under some of these federal programs that exist. And this last theme here is while we know that food program as a whole, but certainly other supports like SNAP, like WIC, are trying to solve issues, right? As it relates to families who don't have the adequate amount of food. But we know that if root causes were addressed, right, would we need these programs at all, right? So there's recommendations in the agenda as it relates to what those root causes are. So things like being able to provide enough grocery stores, right? So being able to think about food deserts, being able to think about family-friendly policies like paid family leave, right? Like housing assistance, right? All of these different efforts that exist that if a family has those basic needs met, then then the likelihood that they would need, right, programs like SNAP and WIC isn't isn't totally eliminated, but is decreased. So the advisory thought it critical to make sure that they were speaking to what those to what those root causes are, and then how they can be addressed through a unique set of policy solutions. So just quickly, a bit more on the recommendations, right? I talked about how this is kind of one of the crux of this effort was being able to really shine the light on prenatal-to-three families and their food insecurity. Prior to this, right? One area that we had found is that there wasn't a robust set of data, right, out there, right? It existed, but cut and in a way that really shines the light on those particular families. So critical through this process. Our partners come from a variety of different worlds, right? So we thought important to bridge the gap between hunger, nutrition, right, and also the early childhood space. So all of those voices in a room, right, talking about what's best for families. At the core of this, where if we can ensure that more families are food secure, right, then we're improving the health of mom and baby, and also setting the stage for the future security of a family. And within the agenda, right, I kind of talked about the short and long term, but it really is like, how do we address things right now? How can we make sure that more families are able to access SNAP now? And in the future, how do we use technology to make sure that SNAP is runs even better, right? So that kind of that approach really helped provide the advisory with a clear path as to how they saw the future of lots of this work. And so I mentioned that there's many recommendations, just a quick snapshot of one theme. And so there's very specific pieces as it relates to SNAP and WIC, but yes, here's just a quick snapshot of some of those recommendations. And so going forward, right, this was a kind of a two-part effort, right? The first was really to develop this agenda that provides really a roadmap for really the field, right? Here are key things that need to be worked on. Now, what the thinking here is to continue down that road, right? And so we're going to be continuing to work with the national partners that I listed. They're going to be continuing to fight federally, nationally, right, to implement lots of the recommendations that are in the agenda. So they'll over the next year to 18 months. But we're also going to be working with some key states in order to be able to help support them working towards the implementation of lots of the pieces of the agenda. And so just wanted to give folks a flavor of who those states were or who those states are, right? So if you're in one of those states or have connections to one of those states, we'd love to kind of chat further. But again, the thinking here is that over the next year or the next 18 months, continuing kind of this Nourish from the Start movement. We'll have our national ed advisory. We'll have some state partners that will support to kind of implement some of the pieces at the state level. And then the thinking here is that we'll have a larger action network, right, of folks who are interested in pieces of the agenda or staying connected to the work that's happening. There is the Nourish from the Start site, which I believe was dropped in the chat, which you can check out the agenda. You can also check out how to sign up as a part of the Action Network and to stay in the know about this movement and about the work that's happening. And yeah, so that is also, I think we have some time for some questions.
Thank you, Amilcar. Yes, the agenda is in the chat, as is the website, and I would encourage people to check out the toolkits. You have some great toolkits on that website that I have already shared with a couple of other people, and we would love to have you back later on to see how this is going. But so I'll set it up with a first question for you. The people that are on this call, how could we be helpful in supporting the agenda and moving this work forward in our individual states and organizations?
Definitely, yeah. Yeah, that's a great question. So I think so the first is, I think joining the Action Network, right? So being able to go on the site, being able to check out the agenda, to sign up for updates, right? That's I think the first, right? As a part of this network, we'll be doing a number of webinars and producing a newsletter once a month that shares updates nationally and from the states that will be funded to implement lots of this work. So that's kind of the first thing. If you're in one of those states that I mentioned, I think connecting with the partner, with the Nourish from the Start partner in that state, they are going to be charged with really kind of trying to build a coalition of folks, right? If it does not exist around prenatal-to-three, so they're going to need tons of folks engaging with them and helping to move some of the pieces of the work forward. And if you're not in one of those states, we definitely want to continue to hear about some of the challenges that are going on, right, as it relates to SNAP, as it relates to WIC. But we would love to kind of be engaged with folks and to continue to hear about the great work that's happening.
Quick question to follow on that. So when you're talking about the state level action network initiatives, is any of that taking into account the you're talking about long-term effects of healthy families from this, but what about the longer term, like just population health overall by reducing chronic disease risk by ensuring people are born and have that first 1,000 days of healthy nutrition? Is that part of the conversation as well?
Yeah. So it's interesting. I talked about how this effort really brought together three different worlds, right? I mean, nutrition, hunger, and then early childhood. So lots of conversations about the importance of the first 1,000 days and how if we don't get that time period right, it will set the stage for future health issues, right? And so as we're scoping out the future webinars and conversations, that's a key topic that, and one of the first ones that we really want to put center in the agenda. Folks will see that the framing about how we talk about this issue is that, but I think now as we're really getting going with some of the state partners, that's going to be, I think, really at the forefront of the conversations going forward.
Excellent. We have a question here that's, I think, open to either one of you who has an answer. So, do you perceive childhood nutritional education programs as useful to increasing awareness of the importance of diet and nutrition to health? And if so, how does your organization participate in that area?
Shannon, do you want to go first?
Sure. I absolutely perceive those as useful to increasing awareness. When I read this first question, my first thought was around WIC, nutrition education, and how a lot of those pieces, given the changes to the dietary guidelines and the WIC food packages, that have some just recently very much rolled out or are in the process of rolling out, I see an opportunity there with WIC. We're going to have to change the nutrition education with WIC anyway because these other things have changed. So how can we better integrate child nutrition programming into that work to ensure that it comes through with the WIC program? As far as the second part of the question, how does our organization participate? ASTHO works really closely with the National WIC Association to do a lot of that work. But for those who are unaware, WIC programs fall directly underneath the purview of a health department. While they may sit separate, they are completely under the purview of the state health official. And so we do what we can to help support that work and connect into either departments of agriculture or human services or whomever is receiving additional federal nutrition dollars.
Oh, you're muted,
Sorry.
Amilcar.
I was at so the National WIC Association was a key partner at the table, and they reviewed the agenda. So, from that perspective, a lot of the recommendations that are in there and our thinking was informed through them, and I think certainly, as Shannon said, critical, right, to ensuring that young children are, again, when we think longer term, are set up from a great perspective as it relates to health outcomes.
I think the one
We have
other
a
thing I would
couple.
say, sorry, the one other thing I would say about that is that, and I think someone just made a comment about it in the chat, that it's hard to get parents to actually show up to these classes. I think something that we on the whole as kind of like a field struggle with is meeting parents and families where they are. It is really hard to get a busy parent to come and to sit in a nutrition education class, especially if they have multiple children, if childcare is an issue, they have a job, all sorts of things. And so I think something that we as a field need to explore is how can we be more innovative to meet those parents and families where they are. The education is incredibly important and will remain incredibly important. But when we think about WIC, what can we do with innovation dollars or other programmatic dollars through Title V or something like that to help find more creative solutions to reach parents where they are so that they are still getting that nutrition?
So I have a couple of specific questions I think about the Nourish agenda. One was, do the recommendations cover nutrition incentives and produce prescription programs?
Yes. So
Okay.
they're under that third theme I mentioned in terms of healthy and culturally appropriate food. So there's definitely a couple of recommendations in there about that.
Another one, 100% of Medicaid beneficiaries are eligible for WIC. Are the recommendations to automatically enroll in both? Are you recommending integrating health and WIC visits?
Yeah, so there's not a recommendation specifically on that, but there was lots of conversation, right? And this the agenda was being developed last summer. It started when things were chaotic with HR1. So I through revisions, I don't believe that ended up being a specific recommendation, but we there was robust discussion about what that could and should look like.
And I think Diane was answering this in the chat, but do you just want to remind us how to sign up for the Action Network?
Yeah, so if you go through onto the Nourish from the Start website, there should be um, uh, uh, a uh, a sign up like where you can put your email address and your information, and that should be able to sign you up. I was trying to find the QR code that will take you there, but I could not find it. So I'm gonna try to get it and then add it to the deck and when it goes out. But in the interim, there should be a form where you can go on there and sign up.
All right. Well, I want to thank you both so much for being here. I'm going to pass it back to Rachel to wrap us up, but know that we will be sending out an email within the next couple of days, and we're going to share information from both of these wonderful presenters, including their contact information. So if there is a reason that you need to get in touch with them, something you heard today that really just piqued your interest or seems like something that might be a collaborative opportunity, we encourage you to do that. And we hope to see you again in September. And I'm going to pass it back over to Rachel now.
Thank you,
Thanks.
Liana, and thank you so much, Amilcar and Shannon, for joining us today. It was a really great, rich conversation. No doubt, your Nourish from the Start agenda is going to need a lot of help and a lot of partnerships, folks doing the work in their communities and their states. So we're here to help. We're a network that also can help get involved. So I look forward to looking at the agenda more closely and figure out where there are alignments that we can help. And Shannon, you pointed out from your report the importance of partnerships. Super important, and we talk about it all the time. So appreciate you highlighting that as something that came out as a priority and an important lever in all of this work. So we are about at the top of the hour. Again, thank you to our panelists who joined and Liana for keeping the conversation moving. Thank you for everyone that joined today. I want to make sure that you all sign up for the series. You can do that. The link has been added to the chat. You can sign up for the series and then not have to think about it again if you'd like to do that. And if you can't make a meeting, you'll get the recording. So the next meeting will be September 2nd, the first Wednesday in September. The Mentimeter comments you gave us will be really valuable in helping us think about some of the next steps we're going to take. So a few things already came to the top of my mind as you all were filling that out. So thank you so much. We are going to be following up with an email with the resources from today. There will also be a survey about the meeting and what you liked, what you want more of or differently. And really encourage you to please consider filling out the virtual Rolodex when that information comes out to you. We'd really love to have a way to have a password protected place, probably a Google Drive where people can see who comes to these meetings and what they're working on. So people have additional ways to make those partnerships. All right, everyone. Thank you so much. Happy beginning of summer to everyone. Stay well and look forward to seeing you soon and following up with some more information after this meeting. Have a great rest of your week. Thank you.